Hey, this is Dr. Chaffin from Simply Implant Institute here in Phoenix. I actually was just going to sit down today, have my little drink. I'm going to be playing golf here shortly and talk about restorative dentistry. All right, about implants. It's not just all about implants. Okay, it's funny. I noticed the students that come into our school for first 4 days, they're really pumped on implants. It's all about the implants, implants. And then after 4 days, they're caring about what's the restoration. So we're going to talk about implants and the restorative needs on full mouth cases. All right. Most people, when they get into implants, think about ones and twosies and things like that. But the world's going into full mouth reconstruction. And how do we break that down? And why is the restorative components? And how do you separate full mouth recon into different categories? So generally today, this little tip is about the different categories that I kind of like to segregate things in when you're talking about full mouth rehabilitation, not ones and twosies and things like that. So the first thing that I like to do is, your first full mouth type of reconstruction that you typically see are the full mouth cases that involve crowns. You're not missing any teeth, the bite's overclosed, and you just got to restore it. So those kind of cases are without implants, but I like to put in the category because that's part of your full mouth recon. I do see a lot commenting on this first type case, which is, so if you guys are writing this stuff down, just kind of put case type 1 is full mouth reconstruction with no implants, just crown work. Now, how do you accomplish that kind of case? Well, very simply put, you have to reposition the bite in a lot of the times. But for this first case type, we're going to talk about just full mouth recon, no repositioning. You got enough beautiful room. The guy's not symptomatic TMD. Everything's just, he's got a bunch of decay and you just need to restore him. Pretty easy case. You got to design it. You got to do it. You got to learn those techniques to have a really beautiful outcome. Definitely want to tell my students and anybody watching, always concentrate on ideal aesthetics, profiles, the lengths of the teeth. Use a really appropriate lab for that kind of work, and it will make you that much better. The case type 2 that I like to talk about in categories are the full mouth reconstructions that involve vertical dimension opening. So back to case type 1, those full mouths are crowns. I mean, it's just generally crowns. But if you have some missing teeth in there, you can do implants at the same time. All right, so let's call that type 1. Full mouth recon, not opening the bite. You may have, it's mostly all crowns. You may have an implant variation throughout the mouth. How do you do that at the same time? We teach that here at the school, where you're designing, you're preparing, you're holding, and you're seating. So the case can be done at the same shot, doing the implants, doing the crown work, and life is good. The second case type was going back to is the ones that you're dealing with vertical dimension. You have a patient comes in, he needs crown work, and he has maybe some missing teeth as well. So you're going to do some implant bridge work, or you're going to do singles, or maybe you even do partials without implants. So generally speaking, you look at this kind of case and you're like, wow, the guy's overclosed. What do I do? The reason why I like to mention this type case too is because I see in my career a lot of people not knowing how to reposition. Patient's got plenty of bone, good teeth, it's just overclosed, and at that point they're a little frustrated because they don't know how to correct that. So they go in and make a case easy by pulling the teeth. See that time and time again. So I really, really want to tell all the doctors there, learn repositioning to create ideal aesthetics and ideal profiles and jaw positions, so you can learn how to do those type 2 cases. Those are great cases. If you can give your patients that alternative, what I've noticed for those kind of cases that walk through the door is they probably have gone at that point to, I actually had one yesterday. He went to 3-4 other doctors. They all wanted to pull his teeth. The guy had great bone. He was overclosed, but if we repositioned him, we had enough room to make the crowns beautiful. We had enough space to do the implants. Pretty much a straightforward case. So what made that type case 2 a little more challenging is the repositioning. So learn the technique. Go to one of the top schools. We like Occlusion Connections, but people can make their own decisions regarding that. Okay. Things that you got to look for in case type 2s are symptomatic TMD patients. Some of the techniques out there don't address those matters. And I guess in my revision experience, there's nothing like doing a full mouth recon, repositioning the patient, and the patient having a symptomatic problem and ending up in more discomfort. So you guys really need to watch out for those, because that can really bite you in the ass. So I think that's pretty much what I have to say about case type 2s. Now, from here on out in this video, we're going to talk about the other full mouth procedures that I like to separate in 3 categories. So case type 3, these are cases, the rest of these things that we're going to talk about are when you're losing all your teeth, okay? So case type 3s are in full mouth dentistry is denture category, all right? So general dentists they bring patients losing their teeth all the way up to just what? Regular dentures. So as implant doctors, we have our overdenture category. So overdenture category is you can do those on minimal bone loss. If you've got good bone, you're extracting teeth, you've repositioned their bite, possibly. But if you have a lot of bone, you don't have a lot of interocclusal space, so you're probably going to be doing some kind of locator overdenture. All right, 4 or 5 implants, 3 implants. But you have to keep things smaller because you don't have a lot of bone loss, okay? That category also going to have the kind of cases where you have lots of bone loss. So locators may not be more as appropriate from an engineering perspective. So you may want to do some kind of creative bar or something like that. So that's a category that can pertain to both type of patients that don't have bone, patients that do have bone, and you really can actually have a pretty good product when it comes to that. All right. 4th category, bridges. Gotta love them. All right. Bridges are wonderful because they're just like the same bridges that you did 2 or 3 here, did an implant with a bridge. It's just these kind of cases you're doing the entire mouth. You're usually requiring 6 to 8 implants. You can do immediately load. Case type 4 bridges are wonderful because if you design it, you can extract the teeth, you can load it, make temporaries on the beautiful implants, keeping the profile, keeping the shapes. And this kind of category is broken down into FP1s, 2s, and 3s. FP1s are the ones where you can use that just like you are now. I don't have a lot of bone loss. Maybe Dr. Chaffin's losing his teeth. Well, I would be in a category for full mouth. Either I'd be a denture patient or you would give me more of a bridge category FP1. So really, let's just kind of make this category really simple. The bridge category, FP1s, 2s, 3s, the only difference is FP2s are for you got some bone loss, all right, maybe mild bone loss. Well, so we'll do some bridges and we'll do some pink porcelain, but the profiles will be nice. It will be a fixed category, so I don't need to have the patient come back once a year to take the thing out, okay? That's a huge difference on bridges. Fixed, not taking them out. They're made out of porcelain. A lot of them will do a framework and stack porcelain. They're absolutely gorgeous. And FP3s are bridge work too, but there's a lot more porcelain, and those are for moderate to encroaching on the severe side. You can, there's a borderline there that's almost like a hybrid, but it's still a fixed prosthetic. And you can do these. I've done gunshot victims where they've blown the side of their jaw off, and I've worked with a Mayo Hospital where we're reconstructing a jaw, and we're doing a FP3 hybrid from here to here, and then we're doing crowns all the way across. So you can get creative in your design and prosthodontics on what the patient presents. But that category type 4 bridges is wonderful because you can get creative with it in a full mouth way. All right. So what's important to know that is those kind of cases usually end up dealing with repositioning. A lot of guys have overclosed patients and they're going to be thinking about bridges, but they don't know how to move the jaw around to create space so they can calculate how much room they've got. Okay. The 5th category that everybody knows about is the all-on-X, all-on-4 hybrid category. Let's just call it the hybrid denture category. This is designed for patients that have no bone, dog shit, tons of it, severe bone loss. So if you're having a patient like that come in,